What if there was a doctor who could see the invisible inside the human body? At Massachusetts General Hospital, Dr. Adam Mitchell, a young autistic surgeon, sees patterns that no one else can, saving lives others had written off. His extraordinary mind diagnoses the impossible, but his struggle with emotional connection puts him at constant risk. In a hospital that values both skill and bedside manner, can a brilliant but different mind find its place? Hit that subscribe button right now to follow this mind-blowing journey where being different might be either the greatest gift or the ultimate obstacle. The sun had barely risen over the Boston skyline when Dr. Adam Mitchell, 26, stepped out of his meticulously organized apartment. The city's iconic red brick buildings reflected the first rays of sunlight as he followed his usual route, counting exactly 1,845 steps to the entrance of Massachusetts General Hospital. First day, 6:42 a.m., temperature 58 degrees, partly cloudy skies. Adam muttered to himself, adjusting his perfectly pressed white coat. The ritual of words calmed him, bringing order to the whirlwind of thoughts and sensations constantly bombarding his mind. The hospital entrance was unusually busy for this hour. Adam immediately noticed the irregular pattern of movement. Something was wrong. A crowd of people clustered together, raised voices, chaotic movement. He approached hesitantly, his hands gripping his leather messenger bag tightly. "He's not breathing right," a woman cried, kneeling beside a boy of about 10, whose lips were taking on an alarming bluish tint. Adam observed the scene for exactly 3.4 seconds. His eyes caught details others would miss. The slight swelling on the right side of the boy's neck, the angle of his head, the pattern of labored breathing. "Permission to examine," he said, his voice monotone and direct as he made his way through the crowd. Without waiting for a response, he knelt down and placed his fingers on the boy's neck. "Possible severe allergic reaction with glottic and laryngeal edema," he declared, without apparent emotion, but with absolute precision. "I need a pen." "A pen? My son is dying!" the mother screamed in panic. "I need a ballpoint pen, removable cap, disassemblable body," Adam insisted, his voice still methodical. A man in a suit extended a metal pen. Adam dismantled it with precise movements, removing the ink cartridge and cleaning the tube with an alcohol-soaked tissue he pulled from his pocket. "I'm going to perform an emergency cricothyroidotomy," he explained, using his apartment key to make a small incision in the anterior region of the boy's neck. With millimeter precision, he inserted the improvised tube. A sudden hiss of air, followed by the gradual normalization of the boy's color, indicated the success of the procedure. At that moment, the emergency team finally arrived with a stretcher. "Who did this?" asked a middle-aged female doctor, examining the improvised procedure. "Dr. Adam Mitchell, first day of surgical residency," he replied, standing up and adjusting his coat. The patient presented with acute angioedema, likely triggered by food allergy. Intervention was necessary within 60 seconds, or irreversible brain damage would occur. The doctor stared at him, impressed and confused. "You just arrived and already performed an improvised cricothyroidotomy at the hospital entrance?" Adam tilted his head slightly. It was the only logical intervention available considering the time and resources. As the boy was rushed inside the hospital, a gray-haired man with an imposing posture approached. "Dr. William Parker, hospital director," he introduced himself, extending his hand. "I just witnessed something extraordinary, Dr. Mitchell." Adam hesitated before shaking the offered hand. "I merely followed the protocol for acute airway obstruction without available medical equipment." Dr. Parker smiled. "You saved that boy with a pen. I'd like you to join me for a meeting in my office after your initial orientation." Adam checked his watch. "That would alter my schedule by 42 minutes. Sometimes the best days are those that don't follow our plans," Parker replied with an enigmatic look. "Welcome to Mass General, Dr. Mitchell. Something tells me your presence here is going to change a lot of things. As Adam proceeded to the main lobby, he didn't notice the mixed looks of admiration and distrust that followed him. His first day had just begun, and he had already shattered all expectations. The administrative board meeting room at Massachusetts General Hospital was a study in contrasts. Imposing mahogany furniture and cutting-edge technology coexisted in an environment that exuded both tradition and innovation. Dr. William Parker stood before the 9 board members, all important figures in Boston's medical scene. "What I'm about to propose is unusual, I admit," Parker began, walking slowly around the room. "But I ask that you keep an open mind." Dr. Eleanor Weiss, head of neurology and the board's most senior member, adjusted her glasses. "Bill, you called us in urgently to discuss a resident who just arrived today?" "Not just any resident," Parker replied, projecting security camera images showing Adam performing the emergency procedure. Dr. Adam Mitchell, 26 years old, Harvard graduate with honors, estimated IQ above 160, and autistic. A murmur ran through the room. He saved a life using a pen and a key before he even officially entered the hospital. Parker continued. But that's not the most impressive part. Parker displayed the medical record of the boy who had been saved. Timothy Weber, 12 years old. Elevated histamines, clear indication of severe anaphylaxis. Dr. Mitchell's diagnosis was instantaneous and precise. No prior medical history of the patient. No equipment, just observation. Dr. Marcus Hayes, chief of surgery, crossed his arms. "Impressive. But what exactly is your proposal?" "I want us to consider Dr. Mitchell for the Special Advanced Residency Program," Parker answered. "He possesses an extraordinary ability for anatomical visualization. He can literally see inside the human body through external patterns." "Bill, this sounds like science fiction," Dr. Weiss contested. Parker smiled. "I thought the same until I saw his academic record. He can identify facial microexpressions indicative of internal pathologies. He recognizes vascular patterns imperceptible to most doctors. It's as if he has an internal scanner. And he's also autistic," noted Dr. James Crawford, financial director. "How will he handle patients? Chaotic emergencies? Pressure?" "He just proved that at the hospital entrance," Parker retorted. "Yes, he's socially different. Yes, he has difficulties with unstructured interactions. But his medical mind is possibly the most extraordinary I've ever seen." The room fell silent for a few moments. "He doesn't pass traditional interviews," Parker admitted. "He doesn't make eye contact, doesn't engage in small talk, doesn't demonstrate empathy in the conventional way. But I guarantee that if we ask him to describe cardiac anatomy, he could detail every muscle fiber with millimetric precision." "And the other residents? The patients?" Hayes questioned. "A hospital isn't a controlled laboratory. That's why I'm proposing a probationary period," Parker explained. 6 weeks. I'll assign a mentor to accompany him. If it doesn't work out, he follows the regular program. Outside the room, Adam waited, sitting perfectly upright, eyes fixed on a point on the opposite wall. Every 30 seconds, he checked his watch. His meticulously planned routine was crumbling, but something unusual was happening in his analytical mind. Curiosity. Inside the meeting room, the discussion heated up. "We can't risk the hospital's reputation on an experiment," Crawford argued. "On the contrary," Parker countered, "imagine the advances we can achieve with a mind like his. Imagine lives we can save." Dr. Weiss, who had remained silent for some time, finally spoke. "My nephew is autistic. He sees the world differently, sometimes more clearly than all of us. I support a probationary period." The vote was close, 5-4 in favor of Parker's proposal. When the door finally opened, Adam stood up immediately. "Dr. Mitchell," Parker called, "I'd like to introduce you to the administrative board." Adam entered the room, his eyes quickly scanning all the details. the exact number of chairs, the distance between each person, the breathing patterns of those present. Dr. Mitchell, Parker began, are you familiar with our advanced residency program? Yes. Access to complex surgeries, integrated clinical research, rotation in all specialties. Only 2% of residents are selected. Adam responded with mechanical precision. The board has voted to offer it to you, conditional on a probationary period, Parker explained. But first, I have a question. Why did you choose medicine? Adam was silent for exactly 12 seconds. When he spoke, his voice was slightly less monotone. At age 7, I observed a woman faint in a supermarket. Everyone panicked. I noticed her left lip drooped 2 millimeters more than the right, and the left pupil was 0.5 millimeters more dilated. I told my mother, left side of the brain, elevated blood pressure. The paramedics confirmed, acute ischemic stroke. That day, I realized I could see what others couldn't. He paused. The human body follows patterns. I understand patterns. An impressed silence filled the room. Dr. Mitchell, Parker said, smiling, welcome to the advanced program. Tomorrow you'll meet your mentor, Dr. Sarah Chen. She's our best cardiothoracic surgeon. As Adam left the room, Dr. Hayes approached Parker. You're playing with fire, Bill. He might be brilliant, but hospitals are human places. Parker watched Adam walking down the corridor, impeccably aligned, oblivious to curious glances. Perhaps we need to redefine what it means to be human, Marcus, he replied. And who better to teach us that than someone who sees the world completely differently? The digital clock read exactly 7:30 a.m. when Adam entered the resident's locker room. He had calculated precisely the time needed to change clothes, organize his locker according to a chromatic system, and arrive 5 minutes before his scheduled time to meet Dr. Chen. Hey, you're the pen guy, right? An animated voice interrupted his meticulous routine. A young man with a relaxed appearance extended his hand. Tyler Bennett. First year, too. Adam looked at the extended hand for 2.3 seconds before briefly shaking it. Adam Mitchell. Dude, everyone's talking about how you did that improvised cricothyroidotomy yesterday. That's legendary for a first day. Tyler spoke while opening his disorganized locker. And now I hear you're already in the advanced program? That's like impossible. Not impossible. Just statistically improbable, Adam corrected, adjusting his stethoscope to rest perfectly centered on his neck. The calculated probability would be approximately 0.04%. Tyler laughed. You're different, man. I like that. Other residents entered the locker room, casting curious glances in Adam's direction. He noticed the whispers, the micro-expressions of envy, curiosity, and skepticism, mentally cataloging them as he did with all observable data. Dr. Mitchell? A nurse appeared at the door. Dr. Chen is waiting for you in the simulation lab. Adam checked his watch. 7:43 a.m. I'm 2 minutes early for our scheduled meeting. The nurse smiled. Dr. Chen always arrives early. Best not to keep her waiting. The simulation laboratory was a high-tech space in the hospital basement. Advanced mannequins, virtual reality equipment, and surgical simulators formed what many considered the most advanced medical training center on the East Coast. Dr. Sarah Chen, 38, was bent over a digital cardiac simulator when Adam entered. Small in stature but imposing in presence, she had short black hair and intense eyes that seemed to evaluate everything around her. Dr. Mitchell, she said without looking up, punctuality is an undervalued virtue in medicine. I'm impressed. Arriving on time is logically efficient, Adam replied, cautiously approaching. Chen finally raised her eyes. They say you can see inside patients. Let's test that. She pointed to the simulator. What do you see here? Adam observed the 3D projection of a beating heart. Male patient, approximately 45 years old. Mild to moderate left ventricular hypertrophy, indicating untreated hypertension for approximately 5 to 7 years. There's a 62% narrowing in the anterior descending coronary artery and early signs of mitral regurgitation. He paused. And there's a small congenital anomaly in the aortic valve that wasn't included in the simulation report. Dr. Chen blinked, genuinely surprised. The aortic anomaly is a detail I deliberately added to the model last night. It's not documented anywhere. She crossed her arms. How did you notice it? The blood flow presents a specific turbulence during systole. It creates a micro-identifiable fractal pattern on the adjacent arterial wall. Adam explained, as if it were obvious. Interesting. Dr. Chen turned off the simulator. Dr. Parker told me you have an extraordinary gift, but also mentioned equally significant challenges. My formal diagnosis is autism spectrum disorder, level 1, previously classified as Asperger's syndrome. Adam replied without hesitation. I have difficulties with unstructured social interactions, non-literal language, and sensorially chaotic environments. I also possess eidetic memory, advanced visual processing, and pattern recognition capability in the 99.7th percentile. Chen smiled slightly. I appreciate your honesty. Most doctors take years to admit their limitations. She picked up a lab coat hanging nearby. Today you'll accompany me. I have 3 consultations, a conference with residents, and a myocardial revascularization surgery scheduled for 2 p.m. Understood. Adam nodded. As they walked the corridors, Chen explained, I'm not here to evaluate your medical knowledge, Dr. Mitchell. I'm interested in how you interact with the hospital environment, with patients, with the staff. Should I modify my standard behavior? Adam asked. Absolutely not, Chen replied firmly. This hospital doesn't need another doctor trying to fit into a mold. We need your unique perspective. She stopped before entering the first exam room. Just remember, sometimes patients need connection more than correction. The first patient was a 72-year-old woman, Mrs. Eleanor Griffin, scheduled for post-pacemaker implant follow-up. Good morning, Mrs. Griffin, Chen greeted warmly. How have you been feeling since our last consultation? Oh, doctor. Chen, much better. I could play with my grandchildren over the weekend without getting out of breath, the elderly woman responded enthusiastically. She looked curiously at Adam. This is Dr. Mitchell, a talented resident who's accompanying me today, Chen introduced. Adam noticed the slight tremor in the patient's hands, the slightly yellowish coloration of her eye sclera, and the way her right ankle was swollen. The consultation proceeded normally until Adam, who had remained silent, suddenly spoke. Your thyroid medication is maladjusted, he said, his voice neutral, and you've developed early-stage congestive heart failure in the last 18 days. The room fell silent. Mrs. Griffin blinked, confused. Dr. Mitchell, Chen began with a controlled voice, could you explain your reasoning? Adam pointed clinically. Fine tremor in the hands, characteristic of mild hyperthyroidism. Subtle scleral jaundice, indicating recent liver overload, probably due to altered medication processing. Asymmetric edema in the right ankle, with recent onset based on the watch mark on the left wrist, suggesting she adjusted it due to swelling. He paused. There's also an almost imperceptible early Cheney-Stokes respiratory pattern. Dr. Chen quickly verified the signs Adam pointed out, her face changing from concern to surprise. Mrs. Griffin, when was your last thyroid medication dosage? Chen asked. Well, my family doctor increased the dose about 3 weeks ago. 30 minutes and a few quick tests later, Adam's prediction was confirmed. The new dosage had triggered an early-stage heart failure that hadn't been detected. In the corridor, after adjusting Mrs. Griffin's medications and reassuring her, Chen confronted Adam. Your diagnosis was correct, but your communication method was abrupt. I communicated the relevant information efficiently, Adam replied. Efficient, yes. Empathetic, no, Chen corrected. You scared the patient. Doctors need to calibrate not just the what, but the how. Adam processed the information. I understand the need to adjust the communication protocol to minimize the patient's stress response. Chen smiled slightly. It's a start. The following consultations were similar, surprisingly accurate diagnoses from Adam, followed by subtle corrections from Chen about his approach. In each case, he identified conditions that would have gone unnoticed in a regular examination. During the conference with residents about complex cardiac cases, Adam remained silent until one of the doctors discussed a particularly challenging case of a 50-year-old man with unexplained symptoms. The patient presents a typical chest pain, but all cardiac tests are normal, the senior resident explained. It's not the heart, Adam said suddenly. It's the esophagus. The resident frowned. We've already ruled out acid reflux and esophageal spasms. It's not that, Adam continued, standing up and pointing to the projected CT scan. There's a small outpouching in the posterior esophageal wall, consistent with early-stage Zenker's diverticulum. It's almost imperceptible at this angle, but it alters the contrast distribution pattern by 0.2 millimeters. The entire room looked at the image, unable to see what Adam was describing. Dr. Chen leaned forward, examining carefully. After a few seconds, her eyes widened. He's right. We need a specific endoscopy to confirm, but she looked at Adam with a new expression of genuine respect. At the end of the day, before the scheduled surgery, Chen took Adam to the cafeteria. You don't need to eat with me, he said. I can feed myself in 8 minutes and meet you in the surgical prep room. This isn't about efficiency, Dr. Mitchell, Chen explained, serving herself coffee. It's about getting to know you better. Why did you choose surgery? Adam considered the question. Surgery is precise. It has clear protocols. It's a logical system for solving defined problems. Most surgeons I know chose the specialty for the prestige or the adrenaline, Chen commented. Your answer is refreshing. Adam was silent for a moment, then said something unexpected. People are confusing. Bodies aren't. Bodies always follow rules, even when they're sick. He paused. When I operate, I understand what I'm seeing. It's reassuring. Chen studied him with genuine interest. You might be the most honest physician I've ever met, Adam. It was the first time she had used his first name. The revascularization surgery was scheduled to last 5 hours. In the operating room, Chen allowed Adam to observe closely while she worked precisely on the exposed heart of the patient. Dr. Mitchell, what do you observe about the right coronary artery? Chen asked during the procedure. Adam, completely focused, replied, There's undetected arterial calcification in the proximal segment. The graft will need to be repositioned 3 millimeters more distally to avoid postoperative stenosis. Seat? The assistant surgeon looked at Chen skeptically, but she was already examining the indicated area with greater attention. You're absolutely right, she confirmed, adjusting her approach. How did you see that? The surrounding vascularization pattern shows a compensatory deviation of 0.4 degrees. This only occurs in the presence of progressive obstruction. Theater. At the end of the surgery, successful and 40 minutes faster than anticipated, thanks to Adam's observations, Chen called him to a private room. I'm going to strongly recommend your permanence in the advanced program, she said directly. Your technical knowledge and diagnostic capability are exceptional. Adam nodded, without expressing visible emotion. However, Chen continued, you'll need to work on your communication with patients and colleagues. I'm not asking you to change who you are, but to learn to translate your unique perception into language that others can understand and accept. That is challenging for me, Adam admitted. I know, and that's why I'll continue to be your mentor. Chen picked up her lab coat. Meet me tomorrow at 6:30 a.m. We have an emergency surgery scheduled. As she was leaving, Adam spoke. Dr. Chen, thank you for not trying to fix me. Chen paused at the door. Adam, people like you don't need to be fixed. The system is what needs to adapt to recognize different types of brilliance. She smiled slightly. Besides, you saved 2 lives today that I might have lost. Who am I to question your methods? Later, as Adam walked alone through the silent hospital corridors after his first full day, he observed the patterns of lights reflecting on the polished floor. Predictable, organized, understandable patterns, unlike people. But for the first time in a long while, he felt that perhaps, just maybe, there was a place where his unique mind wasn't just tolerated, but truly valued. 3 weeks had passed since Adam's first day at Massachusetts General Hospital. Boston's autumn painted the trees in shades of red and gold, creating a vivid contrast with the clear blue sky. For most passers-by, it was just a beautiful seasonal landscape. For Adam, it was a catalog of precise data on humidity, temperature, and plant biology. In the doctor's lounge, Dr. Parker conversed with Dr. Chen, reviewing the progress of the Mitchell experiment, as some board members informally called it. "So, 3 weeks?" Parker began, taking a sip of coffee. "What's your assessment?" Chen placed a folder on the table. "Clinically, exceptional. He correctly diagnosed 47 cases that other doctors had misinterpreted or incompletely understood. His surgical skills are precise, though still developing. And the human side?" Chen sighed. "Complicated. Some patients are disconcerted by his frankness. Others appreciate his direct honesty. The nursing staff was initially resistant, but after he diagnosed Nurse Rodriguez's pulmonary embolism just by looking at the vein pattern on her neck, she shrugged. Let's say he's gaining allies. And the other residents? Mixed. Some resent him for his rapid promotion and unusual abilities. Others, especially Tyler Bennett, seem to have taken him under their wing. It's an interesting dynamic." Parker smiled. "And you? What do you think of him?" Chen reflected for a moment. "He makes me question everything I thought I knew about what makes someone a good doctor." In the pediatric ward, Adam was doing something unusual for his routine. An unscheduled visit. In the 21 days since his arrival, he had established a rigorous pattern, rarely deviating from his established schedules. But today, he was there by choice, during his rest period. "Doctor." "Adam!" The animated voice came from a bed decorated with colorful drawings. Timothy Weber, the boy Adam had saved with the pen on his first day, was sitting with a tablet in his lap. After the anaphylactic incident, it was discovered that Timothy had a rare allergic condition, requiring prolonged hospitalization for tests and treatment. "Hello, Timothy," Adam replied, maintaining his usual distance, but coming closer than he would with other patients. "As agreed, I brought additional educational material about human anatomy." The boy's face lit up. "Cool. Did you bring that 3D app you mentioned?" Adam nodded, taking a tablet from his bag. Over the past few weeks, he had developed an unlikely connection with the young patient. Timothy, fascinated by science and fearless in the face of Adam's frankness, bombarded him with questions that most adults would consider inappropriate or uncomfortable. "My mom says you're different." "Like me," Timothy commented as Adam set up the app. "I have ADHD. What do you have?" "Autism spectrum disorder," Adam replied without hesitation. "Our conditions are neurologically distinct, but share some overlaps in how we process sensory information." "Cool," Timothy simply replied. "Is that why you can see things other doctors can't?" Adam considered the question. "Partially. My brain processes visual information differently. I perceive patterns and details that many people unconsciously filter out. Like a superpower," Timothy concluded. "Superpowers are fictional constructs. It's just atypical neurology." "Still cool," Timothy insisted, flipping through the 3D images of body systems. "When I grow up, I want to be a doctor like you." Adam felt something unusual, a small contraction at the corner of his lips. He was almost smiling. The moment was interrupted when his hospital pager beeped. Emergency in the ER. Urgent surgical consult needed. I must go, Adam said, standing up. Will you come back tomorrow? Timothy asked hopefully. Yes. 2:30 p.m. I'll bring the nervous system model. In the emergency room, the scene was chaotic. Paramedics rushed in with a stretcher. Female, 34 years old, automobile accident, lateral impact at approximately 45 kph. A paramedic informed, blood pressure 90/60 and dropping, tachycardia, suspected internal hemorrhage. Doctor Chen was already there, along with Tyler and 2 other doctors. Dr. Mitchell, you arrived just in time. We need a quick assessment. Adam approached the patient. Her face was pale, sweaty, with an expression of extreme pain. There was a cut on her forehead, and bruises beginning to form on the left side. Adam didn't touch her immediately. Instead, he observed. Active splenic hemorrhage, he diagnosed after 4.7 seconds, and pneumothorax on the left side, approximately 30% collapse. How do you know? We haven't done any imaging yet, one of the doctors questioned. The thoracic expansion is asymmetric by 3 millimeters. The pattern of ecchymosis in the left upper quadrant of the abdomen has saturation and distribution consistent with splenic rupture. The right external jugular vein is 22% more distended than normal, indicating compensation for initial hypovolemic shock. Chen didn't question. Prepare her for immediate surgery. Dr. Mitchell, you'll assist me. In the operating room, as they prepared, Tyler approached Adam. How do you do it, man? It's like you have X-ray vision or something. I don't have X-ray vision, Adam replied literally. I just observe data that's available to everyone, but often ignored due to natural perceptual filtering. Well, whatever it is, you're saving lives, said Tyler, lightly tapping Adam's shoulder, a gesture that would normally bother him, but that he was slowly beginning to tolerate from his fellow resident. The surgery was intense. The splenic rupture was worse than expected, with active bleeding difficult to control. Chen worked methodically, with Adam anticipating each move with impressive precision. Additional feeding vessel, 3 millimeters to the right of the hilum, Adam pointed out when bleeding persisted after the main ligation. Chen located the almost invisible vessel. Excellent catch, Dr. Mitchell. After stabilizing the patient and repairing both the spleen and the pneumothorax, Chen and Adam left the operating room exhausted but satisfied. Your quick diagnosis gained precious time, Chen acknowledged. The patient probably wouldn't have survived if we had waited for imaging. At that moment, a distressed man approached them. My wife, Caroline Brooks. She was just operated on. How is she? Mr. Brooks, Chen responded. Your wife is stable. We managed to control the bleeding and repair the damage. She's recovering in the ICU. The man sobbed with relief. Can I see her? Soon, Chen assured. First, I need to explain some things about her recovery. As Chen continued talking with the patient's husband, Adam observed the interaction with clinical interest. The micro-expressions, body language, vocal modulations. It was like watching a complex foreign language being spoken fluently. Later that day, as Adam meticulously updated records at an isolated workstation, Dr. Parker approached. How are you feeling after almost a month here, Dr. Mitchell? Adam considered the question. The environment is more variable than initially anticipated, but I'm adapting to the operational parameters. Parker smiled. In English, it's different than I expected. Less predictable, but not unpleasant. Are the other residents treating you well? Dr. Bennett is persistently friendly. Some others demonstrate behaviors indicative of professional jealousy or social discomfort. Most maintain a respectful distance. Parker nodded, thoughtful. And the patients? Adam paused, an unusual hesitation for him. Variable. Some respond negatively to my direct communication. Others, he thought of Timothy, seem to appreciate it. And Dr. Chen? Is she a good mentor? She is exceptionally competent and— Adam searched for the right word. Patient. Parker smiled more broadly. You know, when I proposed your inclusion in the advanced program, half the board thought I was making a terrible mistake, that you would be unable to function in the chaotic environment of a hospital, that patients would feel uncomfortable, that the staff wouldn't accept you. Adam processed the information. Those are concerns logically derived from stereotypes about neurodivergence. Exactly, Parker agreed. And that's why I'm so pleased that you're proving them wrong. Not by adjusting to the system, but by showing that the system can and should expand to accommodate different types of excellence. The next morning, Adam's usual routine was interrupted by an urgent call to the pediatric ward. When he arrived, he found the medical team clustered around Timothy's bed. The monitors showed alarming vital signs. What happened? Adam asked, his voice betraying a note of urgency he rarely showed. He had a severe reaction to a new medication we were testing for his condition, one of the doctors explained. Blood pressure dropping, respiratory distress, possible anaphylactic shock again. Adam observed quickly. Something wasn't right. The patterns didn't match typical anaphylaxis. It's not an allergy, he declared with certainty. It's direct drug toxicity with hepatic complication. His liver isn't metabolizing the medication correctly. Impossible, the attending physician contested. We did complete liver tests before starting treatment. Look at the sclera, Adam insisted, pointing to the boy's eyes. There's very subtle jaundice beginning, and the distribution pattern of the skin rash isn't consistent with allergic reaction. It follows Blaschko's lines, indicative of a toxicodermal reaction. Dr. Chen, who had just arrived, approached and examined the signs Adam indicated. He's right. It's not anaphylaxis. We need immediate hepatic support and discontinuation of the medication. Hours later, Timothy was stabilized. Subsequent tests confirmed Adam's diagnosis. The boy had a rare genetic variant that affected the hepatic metabolism of certain compounds, something standard tests hadn't detected. Timothy's mother, exhausted but relieved, found Adam in the waiting room. "Dr. Mitchell," she said, tears in her eyes, "the head doctor told me that if you hadn't identified the real problem, my son could have—" She couldn't finish the sentence. Adam was uncomfortable with the emotional display. "I merely identified a specific pathophysiological pattern based on observable evidence," he replied. The woman smiled through her tears. "Timothy always says you see things nobody else sees. He admires you so much. He said he wants to be like you when he grows up." Adam felt that strange sensation again, a kind of warmth expanding in his chest. Timothy is an exceptionally observant and inquisitive patient. He said you two are alike, different, but in a special way. She hesitated, then extended her hand and briefly touched Adam's arm. "Thank you for saving my son." Twice. That night, after his shift, Adam didn't go straight home as he normally would. Instead, he went to the hospital roof, a place where others rarely went, especially in the autumn cold. There, contemplating the lights of Boston, he allowed himself to process the events of the past few weeks, the faces of patients he had helped, the diagnoses he had made, the procedures he had performed, the lives he had changed. The roof door opened, and Dr. Chen appeared, looking surprised to see him. "Dr. Mitchell, I didn't expect to find you here. This location offers a panoramic view of the city, with minimal sensory interference," he explained. "It's calming." Chen nodded, joining him in silent contemplation of the city. After a few minutes, she spoke. "You know, when Parker asked me to be your mentor, I had doubts. Not about your abilities, but about how you would adapt. If the hospital environment would be too much for you to handle." "A reasonable concern," Adam replied. "But now I see that the question was never whether you could adapt to the hospital." She turned to face him. The question is whether the hospital is smart enough to adapt to you. Adam considered her words. Adaptation is a bidirectional process in complex systems. Exactly, she smiled. Tomorrow, I'll deliver my final evaluation to the board. I'm going to recommend not only your permanence in the advanced program, but the creation of a specialized position in complex diagnostics that leverages your unique mode of perception. Adam looked at her, genuinely surprised. That would be a significant modification to the standard protocol. Sometimes we need to modify the protocol, Chen said simply, as you've repeatedly shown me over the past few weeks. The next morning, the administrative board met again. Dr. Chen presented her detailed evaluation, supported by impressive statistics. Correct diagnoses, lives saved, improved efficiency. Dr. Parker watched with a smile of satisfaction. When the final vote was taken, it was unanimous, 9-0 in favor of Adam's permanence and the creation of the new specialized position. That same afternoon, as Adam was visiting Timothy, who was now recovering well, Parker entered the room. Dr. Mitchell, I have news that might interrupt your schedule for a few minutes. Adam looked up from the anatomical model he was showing the boy. Proceed. The board voted unanimously to establish a new position of specialist in complex diagnostics. If you accept, you'll continue your surgical residency under Dr. Chen's guidance, but will also lead a new program focused on difficult cases that would benefit from your unique perspective. Timothy punched the air. That's awesome, Dr. Adam. Adam remained still for a moment, processing. This was not in my projected career plan. Parker smiled. Sometimes the best paths are those we don't plan, Dr. Mitchell. In the corridor, after accepting the position, Adam found Dr. Chen waiting. So, you said yes, she observed. It was the logical choice based on the available variables, he replied. Chen smiled. You know what this means? We'll have to work even more on your communication skills. You'll be dealing with more people, more questions, more explanations. Adam nodded. I recognize that challenge. He paused. Doctor, Chen, why did you support me from the beginning, when the statistical probability of success was undetermined? Chen considered the question for a moment before answering. Because medicine isn't just about following protocols, Adam. It's about seeing what others can't see, about hearing what isn't being said, about looking for answers that others haven't even thought to question. She looked directly at him. And who better to teach us to do that than someone who sees the world in a completely different way? Adam absorbed her words, feeling something similar to what others would call pride, an emotion he normally wouldn't recognize in himself. Thank you, he said simply. Don't thank me yet, Chen replied with a smile. Our work is just beginning. Tomorrow, 6 a.m., we have a full surgical list waiting for us. As she walked away, Adam remained in the corridor for a moment. Around him, the hospital pulsed with activity. Hurried nurses, consulting doctors, recovering patients. It was a complex, unpredictable, often chaotic system. But now, for the first time, it was a system of which he was a part. Not as an anomaly to be tolerated, but as a vital piece of the puzzle. An extraordinary mind in a world that was finally beginning to recognize the value of difference. Adam checked his watch, adjusted his lab coat, and headed toward his next task. There were patterns waiting to be discovered, lives waiting to be saved. And for the first time, he wasn't just observing the world, he was helping to transform it. Different minds don't need to be fixed. It's the systems that need to adapt. As Dr. Chen said, medicine isn't just about following protocols, but about seeing what others can't see. So, perhaps our greatest advancement isn't forcing everyone to think the same way, but creating spaces where each type of mind can contribute its unique vision. If this story touched you, smash that subscribe button, hit the notification bell, and share it with someone who needs to remember that being different can also mean being extraordinary.